Next up, we have Dr. Padilla. And so Dr. Arnoldo Padilla Vazquez, he was born and raised in Mexico, where he received his medical degree from the Instituto Tecnológico y de Estudios Superiores de Monterrey School of Medicine. After moving to the United States with his wife, Dr. Vazquez spent 5 years as a research associate at Thrombosis Research Section of Baylor College of Medicine in Houston. In 2005, he began his residency training in internal medicine at the Texas Tech Health Sciences Center in Lubbock, Texas, where he served as chief of residence and was awarded Graduate Resident of the Year. In 2018, he joined the telehealth group MyCatholicDoctor, which is really doing great work in bringing telehealth to Catholics and really anybody who is looking for authentically Catholic telehealth. So Dr. Padilla, thank you so much for joining us here.
Thank you very much. It's an honor to be part of this conference. Well, I wanted to talk to you about generalities about all COVID, and as well touch mostly on the things that we have to do to stay healthy. Most of these have been already widely available for people, but I wanted to focus on understanding why. And this is because we need to understand what's next. We need to what to expect in the next upcoming few months and beyond that. We also need to know some about the potential cures and not potential cures, the treatment that is available, and as well the development of vaccines. So I have a few slides that I'm going to share with you. Give me 1 second here. So, all right. So, 1 minute. Okay. So, James, I mentioned a part of MyCatholicDoctor. I'm an internist, and this is for me a blessing to be part of an organization like MyCatholicDoctor, where we're trying to make Catholic healthcare available to everybody. Regarding COVID, we have to understand how the virus is transmitted. It's a very similar transmission as in influenza, mostly occurring through respiratory droplets coming in contact with mucous membranes, which eventually lead to infection and illness. There is we believe that there's also airborne transmission, but it only happens at short range. And if we keep our distance from people who are sick, we may get away from getting infected from this virus. There's also the belief that there's very low risk for more indirect contact of transmission, like when passing somebody on the street. So we know that transmission can happen before symptoms are present. There's a study in China that showed that we can be infectious for 2.3 days before symptoms appear, and the peak of infectiousness is about a day before the symptoms appear, and after that, the virus being shed starts declining for the next 7 days on a typical case. Of course, if people are sicker, I believe that may last longer. But I guess the latest they found the infectious virus being present on somebody was 9 days. There's studies that showed that RNA can be found in nasopharynx up to 42 days in very sick patients, but this is not the infectious virus. So of course we're still learning about this, and there's more to come. We know that the virus can be present in contaminated surfaces. The length of duration of the virus is a few days apparently. It seems that we're at higher risk in heavily contaminated settings like in hospitals or the household of somebody that is sick. So that's why we have to avoid getting in contact with the virus. You know, we have to be careful with, if we know that somebody's sick, even inside of our homes, we have to be careful. We have to keep those that distance of 6 feet away from sick people. If we're outside our homes, we were encouraged to stay keeping that distance from other people, since asymptomatic patients can transmit it, and we have to avoid being in large groups or in crowded places if we can. Now, of course, it's useful to wear a mask, and I've had that question asked several times. Yes, it's useful because we can help protect others. You may not protect us unless we're wearing a qualified mask for it, but it will protect others if we're using a cloth mask. We still have to keep our distance because we can get sick. And one of the things that I believe that the mask helps is because it may prevent us from touching our faces too much. We have to be careful how we wear the mask and how we remove it. So it's important to do hand washing, use hand sanitizers. There's all these things. Remember to wash your hands. Say 20 minutes. While you do it. 20 seconds, I'm sorry, while you do it. We don't have to use antimicrobial soap. We can use sanitizer if there is no water soap available. We need to make sure that our hands are now soiled when this happens. And at least 60% alcohol concentration is recommended for this to be effective. Do we need to wear gloves, and where do we need to do it? We need to do it when we're caring for the sick, whatever that task is, if it's sanitizing areas or handling secretions or caring for the person. We need to remove these gloves after that. Does it help to be wearing gloves outside, like when we go grocery shopping? Well, it doesn't really decrease the spread of the virus, and we may still get sick because we may end up touching our face anyway, like if we were not wearing the gloves. So it doesn't help, so it's not encouraged. These are the recommendations that are being made for the general public, and we have to follow guidelines at work because those settings will be different. So we need to make sure that we understand what we have to do in the job setting. It's important to clean and disinfect. There is something that is called the List N that is published by the EPA. They have this list in their website, and there's also a link at the CDC website for it. And they have a search box there where you can enter the code from the product we're trying to check to see if it's going to be effective, and it will tell us if it's effective against COVID or if it's an equivalent to an equivalent product, and it will give you some instructions on how to use it, how long we have to leave it on the surface, and so forth. We can use unexpired household bleach as long as it's meant for disinfection. There's a specific dilution you can find at the CDC. I wrote it there. You can also use 70% alcohol solution. It will be effective as well. Now, some information about testing. So where are we regarding this? We know that there is limitations in the availability of testing, but expected that this will improve. And I guess some experts feel optimistic that by the fall, we will have a higher availability to be testing. The CDC is working hard with state labs to make this happen. West Labs and LabCorp, for example, are increasing already their testing capacities, and hopefully this will improve even further. There is hope to develop home kits, which will be useful in reducing the exposure of medical staff in order to obtain a nasopharyngeal sample. Also, it will decrease the need for PPE for this purpose. But that's just hope for it. It's still not available. What is PCR testing? Is the most reliable test we have right now for detecting current or active illness. So it is depending on the timing and the quality of the sample. The timing, because if it's taken too early or too late, we may not detect the virus. I read about cases where they had people that were being tested for COVID. They had very suggestive symptoms, and they were negative, a couple of times with the PCR test, and those patients kept getting sick and eventually ended up on a ventilator. And after getting bronchial aspirate, they were then confirmed that they had COVID. So it's believed that somewhat the virus progresses towards the lungs, even if you're not shedding a lot of virus through nasopharyngeal secretions. So of course, there's a lot to understand. When will this happen? Of course, laboratory quality standards matter. From lab to lab. You have false positives that can be a risk. So we understand that PCR testing, for this reason, should not replace clinical judgment. Clinical judgment. So antibody testing, and there's a lot of questions about this. We're still not very sure how helpful this will be. Will it help us understand if we're getting protective immunity, or just to know if we really were exposed to the virus? There is questions to see if there is correlativity in some tests with other viruses, and that may lead us to think that we've been exposed and when we are not, and we may be at risk for the infection. There is a concern that the severity of illness may affect antibody formation. For example, if we form either IgAs or IgMs or IgGs, and then that can affect the type of results we get, because some tests will look for IgG only, for example, and we may believe that we're negative. So so far it's hope, and it's believed that it will help to assess what is called herd immunity, which means how many members of the population are already immune to it. And what we know, I guess, from early reports from New York, from the first wave of cases that were available, we know that we still have a long way to go in this pandemic. Even though a lot of cases have been reported where a lot of people in the hospitals, still a very small percentage of people have acquired antibodies against COVID, even when counting the asymptomatic cases. So we have a long way to go. Regarding treatments, there is this medication, there's remdesivir. It's a IV antiviral. It is basically blocks the replication of the viral RNA, so there's less copies of the virus being generated. There is an NIH-sponsored study that has shown that in the early results that it shortens the duration of the illness by 4 days. It also seems to be reducing mortality, although it's not for sure. I guess the issue with this study is that they're looking at critically ill patients only. We don't know what it would do in people that are not as sick. They're doing only on critically ill patients, but at least there's some promising results. There's another study that just was started a couple of days ago, actually, where they are using this same antiviral along with Olumiant, which is a rheumatoid arthritis medication. It's an anti-inflammatory drug. And of course, there are no results available, but there is hope that this will be improving in outcomes. We hope. Now, there's been a lot of talk about hydroxychloroquine and azithromycin as therapy. We have anecdotal information only, not very serious studies yet. But there is a new NIH-sponsored trial that will involve about 2,000 patients. It's just starting. They will look at patients with mild to moderate disease, and these will include patients that are over 60 years of age and with some chronic illnesses. So we'll see how effective these medications are earlier in the course of illness, and then also the risk of using them, which is a big concern that has been it's making some people hesitant. You know, these medications together can cause induce something called ST second prolongation, so people can have arrhythmias. So we'll see what the study shows. Now, vaccines, there's a good number of companies, at least 12 of them, working on developing vaccines. There's a lot of pressure to develop a vaccine soon, and this has allowed for research to move faster, the different stages of research that are done. There's already a couple of organizations that are already moving forward to do testing in humans. And the concern with this is that it can affect the information we have about safety of the vaccine. We have to understand also that even though they are moving faster, this will not be ready in a few months. Okay, it will take you know, probably a couple of years, close to that. So what will be also the question? Well, what will be the efficacy of the vaccine? Will they be helpful? And then if they help, how long are they going to be effective? It's like the flu vaccine, you know, that we have to take, you know, every so often, every year. You know, we don't know. It's the same question we have with the immunity that we'll obtain with from COVID. You know, is it going to last for a long time? The belief is that it will not. You know, at least what we understand from other coronaviruses. So what can we expect now as you know, the states are getting reopened? You know, we can expect that the number of cases will increase. It's believed that we'll see waves of cases like the you know, this period that we just saw. You know, the good news is that probably we'll be better prepared, and so we have to face this without fear. We just need to understand that the situation that we have and try to act responsibly. You know, following the indications. You know, what we really what we can do, which is, you know, doing a physical distancing. Doesn't mean that we need to stay indoors all the time. And I think that that's a good choice. Probably we need to be outdoors. You know, it will be useful. It's one of the ways that and I'll mention more about that later. You know, during the summer, more circulatory viruses decrease because we change our behavior. We stay more outdoors. You know, and it seems that the weather may be also affecting how the virus can last outside. You know, there's maybe more moisture, so the virus drops faster to the floor. So there is less risk of transmission. And it seems there is some evidence that our immune system may work better in the summer than in the winter. So you know, so it will depend a lot of, you know, how the virus behaves. We don't know yet, and also about our behavior. You know, what we do, you know, to stay healthy. And of course, you know, exercising, staying healthy with your diet, sleeping well, all those things are important to have good health. So we need to think about that. Now, what will happen during the fall? It will depend on how we do in the summer. You know, how many cases we have, the incidents, that's what it's believed. Now, a big factor will be as schools are being opened again. You know, if we look at people that are still going to school, including colleges, it's about, as I understand, 60 million, you know, of those, you know, students. You know, so what will happen? It will depend on how schools deal with this. Will they decrease the number of members in the class? You know, the number of days they go to school, or will there be virtual education and so forth? So that will be a significant factor, especially as young people don't get sick and they may be carrying the virus and so forth. So if there's any questions, please let me know, and I'll be happy to answer those. So let me see here.
Thank you so much, Dr. Padilla. There are a number of questions. I know that there have been a number of questions. I just want to bring it up about the vaccines, and especially looking at some of the ethical questions and the vaccine is developed using fetal tissues. I know that Dr. Meany is going to probably going to bring up some of those questions or address that a little bit, but I don't know if you have any thoughts to that.
What I would say, definitely, it's a concern as Catholics, if, the way vaccines are developed. We should try to advocate for finding ways to create vaccines that will not require fetal tissue. That's part of our responsibility. I'm a member of the Catholic Medical Association, and know that the organization is very active at trying to promote this. So we need to find the resources and or the places where we can unite and give our support for this. I think that's really important. About receiving a vaccine, that is made from fetal tissue. Well, that's a difficult question. So and it's a big debate that I don't mean to go there. But definitely we have to follow our conscience. How that is. The causality. If it's far away from us, that this was done, that is, we can still receive the vaccine and be okay. It all depends. It's a very difficult question, and I don't think I have the answer. So the question was also, what is the use of having a Catholic doctor? We have to understand that we cannot leave our faith on the side and then just go live in a church. Per se, when we go to mass or so, our faith should rule how we act morally. So in medicine these days, there's so many questions, as I was mentioning, contraception, abortion, end of life care. There's many things that can affect affect us, and we have to make those moral decisions. And I think that a Catholic doctor will be really helpful. We will be very helpful to go there. Also, I can say I had, for example, during the pandemic, I had patients that came looking for me. They couldn't access to their doctor in their clinic, and they have problems with depression and anxiety. They couldn't go back to work. So there was a lot of stress. So it was, other than helping the patient from the medical point of view, to be able to pray with your patient, to try to help them to go back and get in touch with their faith and really trust God. I think that has been a blessing, and that's why I'm so proud to be a member of My Catholic Doctor. It gives me that opportunity, and I have to say that in prior jobs I had to be very careful what I said about my faith, because people can complain or so. I don't have to do this. My Catholic Doctor has been a blessing for me and for my patients. So, finding a Catholic doctor is really important.
And so the website is mycatholicdoctor.com or
yes.
mycatholicdoctor.com.
Yes, mycatholicdoctor.com. Yes, and
so
we're working. It is we're working. Dr. Kathleen Virtualman, she's been working really hard. He's just a true warrior, and we're getting to work. Getting credential with insurances, and we're definitely making big strides in that regard. So I think that as time goes by, we'll be more available to people to getting access.
Thank you. And one last question here concerning especially testing and PPE and sort of the social distancing and the measures that we've been going through as a country, with questions regarding just the efficiency, effectiveness of that. Does a homemade mask actually do anything? At this point with the social distancing, and even with the testing, you could be tested one day, but because it's potentially contracted so easily, the next day you might contract it. What is the value in doing some of these things?
Yes. Well, I think what we understand how the virus replicates. I guess the most important thing would be the social distancing. We don't have to feel that you get walk into the store and forget that you don't have a mask. I don't think that you should just go in panic mode and think. We know that keeping our distance, those 6 feet, is the virus probably won't go beyond that. Keeping our hands clean and touch your face. Those are the important things. Wearing a mask, I think is important for us to protect other people. A cloth mask. Can we use an N95 mask or something to go to the market? I think that would be overdone. You know, if we do the other things, it would be a waste of resources. We're having a hard time coming around those, and I think we have to be responsible in that sense. It will not help us a lot, and you know, we can just do by keeping our distance, I think, and being mindful of what we do with our hands. You know.
Fantastic. Well, thank you so much for your time and insight here, Dr. Padilla.